It's normally a time of great joy. Parents welcoming a baby into the world. But what happens when coronavirus enters the picture?
The news I'd tested positive meant I'd have to give birth on my own, without my husband. The 2 days ahead of the birth were incredibly stressful. I was so afraid for my baby.
With COVID-19 still infecting people, what are the risks of pregnancy and childbirth? Little can be more exciting than the arrival of a newborn, can it? Even though it naturally comes with its anxieties, particularly for first-time parents. However, those anxieties have been added to for those welcoming a baby into a world ravaged by coronavirus.
3 newborn babies who all tested positive for COVID-19. Neither of the triplets' parents have the coronavirus. Health officials in San Luis Potosi State in Mexico are calling the case unprecedented. What we need to consider here is whether the coronavirus could have been transmitted through the placenta. That's not something that we can be sure of at this time. It's a theory that we have to look at. It's a new virus. There's no international literature yet, but this will be worth reviewing. It's just one example that highlights how much is yet to be discovered about the impact the virus can have before and during birth. What we do know is based on limited data. Early studies suggest that pregnant women aren't more likely to fall severely ill from COVID-19. Most newborns who test positive will recover, but there have been some cases of infants falling severely ill. Transmission from mother to baby via breast milk appears unlikely.
So several cases have been identified where there have been RNA fragments, so fragments of the virus in breast milk, but we haven't actually identified live virus in breast milk. And so the risk of transmission from mother to child, therefore, so far has not been established.
Over in Colombia, pregnant women are among the hundreds of migrants who've been trying to cross back into Venezuela as the virus dampens their prospects of setting up a new life. Border closures, part of lockdown restrictions, have left them waiting days to access humanitarian corridors. Conditions are dire, not least for expectant mothers. We're hungry. We've no place to cook, and as long as we've no money, we'll stay hungry. Whether it's overstretched health services, restrictions on movement, or simply a lack of data, giving birth during a pandemic is especially anxiety-inducing. But with every new life comes the prospect of a brighter future, free of COVID-19.
We can now speak to Mandy Mangler. She's the lead doctor at the Vivantes Clinic for Gynecology and Obstetrics here in Berlin. Dr. Mangler, thanks for joining us. How different is giving birth now to even just a few months ago before the pandemic?
Yes, hello. So a few things have changed, obviously, depending on your local healthcare system and where you give birth and how the infection load in your country is. But many women are confronted with visiting rules in the hospital, so they might have to give birth alone and might not be able to be visited after birth. So this is what has changed significantly.
Yeah, and if you've got these extra restrictions in hospital visiting issues, etc., I imagine that might be quite off-putting for some mothers-to-be. So are some mothers choosing not to give birth in hospitals where they might have otherwise?
Yes, some mothers choose to have home births, or they might go to a hospital to give birth and leave the hospital very shortly after the birth. So this would be a good solution, not to stay in the hospital. But many hospitals have taken extra care of mothers and of their newborn babies. So depending on the local system you're confronted with, you might have a secure solution in your healthcare system, or a solution where you are affected with the possibility of infections.
Would you...
So home births are
Yeah, I was going to say, would you warn mothers
rise.
against home births, though, where possible? Would you be urging them, despite, the fact that, they might be worried about hospitals, they've got patients in them that have got coronavirus, but would you still be advising mothers to go to hospital?
Well, yes, I would. Many obstetrical wards have a cocoon strategy. They're cocooning their obstetrical wards. They protect it from infections and from other patients from the hospital. So it depends on what healthcare system you have, but home births carry an extra risk of not being medically assisted during your birth. And there are so many risks coming with this that advising everybody to be at home giving birth is nothing I would say.
And all these restrictions are aiming to prevent both the mother and the baby contracting COVID-19 themselves. But you have dealt with babies who have got the condition. How do you approach that?
Well, there's a national German guideline how to deal with infected babies. For a long time, it was known that babies are not prone to be infected via the blood of an infected mother. But anyway, we have seen some babies being infected, even babies from cesarean sections. So any birth way could lead to an infected baby if the mother is infected. And the national guideline coping with these infected babies says that you should not restrict the mother from the baby or take the baby away from the family. You should, as a mother, if you're infected or not, take extra care of the baby and have high hygiene standards, but breastfeed anyway and not give the baby away. So because babies are not a risk group, even if they contract coronavirus, they might not be severely ill, or most of the babies will not be severely ill.
Dr. Mandy Mangler from the Vivantes Clinic for Gynecology and Obstetrics here in Berlin. Thank you so much for your time. And now it's your chance to ask the questions to our science correspondent, Derek Williams.
When will this pandemic be over?
Yeah, that's the trillion-dollar question, isn't it? I wish I could answer it, but right now, no one can. The WHO has broken influenza pandemics down into 6 stages, and they're only considered over when levels of flu have returned to stable pre-pandemic levels. But if the definition of an end to the COVID-19 pandemic means reaching a stable number of infections worldwide, then we still have a very long way to go. In the absence of measures like social distancing, the number of new infections will only stabilize with the advent of herd immunity, when an estimated 60 to 70% of the Earth's population has been infected and recovered. But a huge vaccination program with a highly effective vaccine would, of course, accelerate that process. So while we can say that this pandemic too will certainly one day end, there's still way too many factors in play for anyone to say exactly when that day will be.
Is there a chance a vaccine could cause the virus to grow more deadly?
To even attempt to answer it, you have to look at what other vaccines have done to viruses in the past. Vaccines, of course, contribute to viral evolution by driving selection. As more and more people in a population acquire immunity, strains, for example, that evolved to be more highly contagious would have at least a temporary advantage. But what advantages would growing more deadly bring SARS-CoV-2? I mean, if people began dying even more than they are now, vigilance would ramp up even higher, and that would lead to less spread. So it's not actually in the virus's best interest to grow more deadly. It's to infect as many people as possible. So I'd say that while there's no question vaccines push viruses to evolve, I don't believe in this case it'll push them to evolve in the direction of greater virulence. In fact, I'd expect a vaccine to push it to be less virulent, but more contagious. But that's just my best guess.
Can you get COVID-19 from an open wound or cut?
To invade the body, SARS-CoV-2 has to latch on to what's called the ACE2 receptor, which is quite abundant in the membranes of cells in the upper respiratory tract, as well as in a range of different organs, including your lungs and your kidneys and your heart. ACE2 is a kind of doorknob that allows the virus to enter those cells. In tissue made up of cells that have few or no ACE2 receptors, like your skin and subcutaneous tissue, the door is effectively locked. So all the evidence indicates that even if SARS-CoV-2 got into an open scratch, it wouldn't be able to turn into a full-blown infection because it wouldn't be able to invade the cells effectively or spread effectively in that tissue. To do that, it has to invade tissue like the membranes in your upper respiratory tract, which carry lots of ACE2.